I'm Tessa. I'm here to talk about urinary tract infection or UTI. If you haven't watched the first part of this three-part video series, I encourage you to watch. The first part is on UTI, or commonly referred to as balisawsaw, and acute uncomplicated cystitis. Please watch it first. Acute uncomplicated cystitis is a bacterial infection leading to the inflammation of the bladder. This is a specific type of UTI which occurs most commonly in women than in men because women have shorter urethras. This means pregnant and non-pregnant, young and old alike may get UTI. In this second part, we will find out if you have acute uncomplicated cystitis and if you have it right now without even knowing about it. What are the warning signs of acute uncomplicated cystitis? Doc, what are the symptoms of acute uncomplicated cystitis?
So acute uncomplicated cystitis typically presents with what we call balisawsaw in Tagalog, but usually the medical term is dysuria. And when you say dysuria, that can mean a whole bunch of symptoms. So whether it's painful to urinate, or it's uncomfortable to urinate, or you can even have some pain in your abdomen when urinating, or even something called frequency, where you urinate all the time, even if you're not drinking a lot of water. It can be very small volumes, or also if you see that the urine is turbid or it's not clear is one of the other things that you see in UTIs. Other symptoms include you may have a low-grade fever if it's already starting to progress, and also sometimes there's a bad odor in the urine, and those are all symptoms of acute cystitis.
So with these symptoms, is it possible to manage it without a doctor?
Well, in general, if you're having UTI symptoms, it's best to see a doctor because a lot of people can have bacteria in their urine, and the urine doesn't really, it doesn't really cause any symptoms. But when you start to see symptoms, then that means that there is an infection that's going on, and you need to seek medical treatment so that your doctor can decide whether you should be started on an antibiotic.
So this would warrant a medical consultation then?
Yes, absolutely, because acute uncomplicated cystitis can progress into what we call pyelonephritis, because when the organism goes up the urethra to the bladder, that's called cystitis. When it goes from the bladder to the ureter to the kidneys, then you can actually affect the kidneys, and from there it can cause a lot of trouble.
So how is acute uncomplicated cystitis diagnosed?
Acute uncomplicated cystitis is typically a diagnosis that is made clinically. In fact, you don't even need a urinalysis to diagnose acute uncomplicated cystitis. A good history and physical exam by your doctor can give him enough information as to whether you deserve antibiotic therapy. They may go ahead and do a urinalysis or urine culture if they think that's necessary. But a lot of times, because this is such a common infection in women, we will go ahead and treat with antibiotics, and we may or may not do some laboratory tests.
Yeah, so I think it's really important for women to be crucially aware of their condition, because it can affect the very young or the very old as well, or people that are in menopause age, or so it's really necessary for them to just have a physical checkup regularly. Or would you say once they have the symptoms of fever or pain, or like you said in their urine, would that send the right signals for a medical examination?
Sure. Well, preventive medicine is always the
Yes.
best, and you really should see your doctor maybe at least once a year for a checkup, make sure everything is okay. But of course, if you're starting to have symptoms of disease, it's very important to be able to see a doctor immediately so that the doctor can prescribe appropriate treatment before it gets worse, because it gets more expensive if you have to end up in the hospital, you're sick, and you can even die if the infection is serious enough. So it's always good to have a good relationship with your doctor. Maybe see them once a year, do the checkup, but more importantly, if you feel bad, then it's probably good to see someone so that you can get better faster.
Thank you so much, Dr.
Okay.
Edsel. Thank you.
All right.
Thank you. I have learned a lot from Dr. Edsel. It is now clear that we don't disregard dysuria or painful urination. Or in the vernacular, huwag baliwalain ang balisawsaw. It can lead to serious complications.